when we have these issues in the field of like perinatal medicine, what we try to do sometimes is we try to separate out, kind of these environmental genetic risks versus the medication risk. One way of doing this is something called sibling controlled studies. So what you do is you look at the same mom, 2 different pregnancies, and you compare the exposure in each of the pregnancies. So it's sibling analyses. And so they actually have done 2 very large studies like that with Tylenol. So same mom, and she used more Tylenol in one pregnancy and maybe no Tylenol in another pregnancy. And what they found is in those studies, there was no increased risk of negative neurodevelopmental outcomes like autism or ADHD with Tylenol use. What that tells me is that Tylenol use is more of a marker for an increased risk for autism, but that it's not actually causing that increased risk of autism.